Hi everyone, in today's clip I will talk a little bit about preventing colds and flu. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health related matters, please consult your healthcare provider. So, colds and flu are among the most common illnesses worldwide. While hygiene is important, nutrition and lifestyle plays a huge role in prevention. Colds usually are caused by rhinoviruses and are mild but annoying. The incubation period for colds are normally 1 to 3 days after exposure, and you are the most contagious before symptoms, usually 1 to 2 days before the symptoms appear, and during the first 2 to 4 days after symptoms sort of start. And also when viral shedding is at the highest. So overall contagious period typically is about 7 to 10 days, but some strains can spread up to 2 weeks or even a month in rare cases. A side note, viral shedding refers to the process by which sort of viruses are released from an infected person's body and spread into the environment, making transmission to others possible. What happens is that when you're infected, the virus replicates inside your cells, and these new virus particles are then shed through bodily fluids or secretions. For respiratory viruses like colds and flu, shedding happens mainly through breathing, coughing, sneezing, and touching surfaces after you have touched your nose or mouth. Flu are caused by influenza viruses. They are more severe and can lead to complications. Flu incubation period so is between 1 to 4 days, average 2 days, and you're contagious about 1 day before symptoms appear, and most contagious first 3 to 4 days after symptoms start and when viral shedding sort of peaks. Overall contagious period is usually 5 to 7 days after symptoms start, but children and immunocompromised individuals can remain contagious for up to 2 weeks. Colds and flu both spread through droplets, contaminated surfaces, and close contact. So prevention is far better than cure, and there's no magic pill, but we can actually reduce the risk significantly. So core prevention strategies would include hygiene. So wash hands and avoid touching your face, nose, or mouth, as well as cover your coughs and sneezes. In public areas, try not to touch your face after touching shopping cart or money or any item really, as this may be touched by an infected person. If you're using public washrooms, be cognizant of your moves and actions. If you put your purse on the ground and later put it on your kitchen counter at home or bedding, chances are you will carry germs with you. Just to give you an idea, cold virus lives up to 24 hours on hard surfaces and sometimes up to 7 days. Flu virus for about 48 hours, even on stainless steel, and about 12 hours on cloth material. Coronavirus lives about 3 days on plastic and stainless steel, and about 24 hours on cardboard and 4 hours on copper. E. coli will live from days to 16 months. Salmonella for about 4 days. MRSA in some cases for many, many months. So when you're touching things, you really don't know what end of the timeline you're touching the virus, whether at the very fresh start of life or sometime at the end when it is a bit diffused probably. So be aware of your surroundings and what you touch and what you do. So the next level of would be sleep and stress management, which is super important when it comes to prevention, because lack of sleep and chronic stress weaken your immunity. Hydration and balanced diet is another preventive measure. Nutrient-rich foods fuel your immune cells, whereas sugar-filled and processed foods weaken them. During the seasons where colds and flu are at their highest rate, ensuring to get enough vitamins is very important. For example, vitamin C, High doses, 1,000 to 3,000 milligrams a day, can reduce severity and duration of colds. This vitamin acts as an antioxidant and supports white blood cell function. As soon as I see any signs, I start taking 2,000 milligrams of vitamin C every waking hour until the symptoms disappear. Then there's vitamin D, which regulates immune response. Low levels are linked to higher infection risk, and suggested dose would be 2,000 to 10,000 international units a day, adjusted to your blood levels. Zinc, this is essential for immune cell activity. Zinc lozenges may shorten colds if taken early. Typical dose would be 20 to 40 milligrams a day. I would stay around 15 personally, because higher doses can cause nausea. Niacin, or vitamin B3, this supports energy production and tissue repair during infection, and the dose would go from 500 to 2,000 milligrams a day in divided doses during the illness. Although I feel 500 milligrams a day offers quite a lot of benefits even when you're not under the weather. Selenium and copper, these work as antioxidants to protect cells from oxidative stress. Probiotics, they support gut health, where most immune cells are residing, and reduce chance of any kind of infection. And I have a clip on pre, pro, and postbiotics if you're interested to know more. Elderberry and garlic, these have shown to reduce severity and duration of the symptoms. Basically, eat a rainbow of fruits and vegetables and consider supplements. Stay active, manage stress, and get enough sleep. Avoid smoking and excessive alcohol because they weaken immunity. Preventing colds and flu isn't about one magic pill. It's about consistent habits and optimal nutrition and hygiene. Vitamins and minerals in the right doses can also make a huge difference. Bottom line, combine lifestyle, hygiene, and targeted supplementation for the best defense. Hope this has been helpful. Like and follow for more. Be the light.